everyone. We're going to get started. I know there's a few other folks going to join us in a few minutes, but we wanted to respect your all time since we are running a little late. So today's panel is Desi Care, Desi Loss, Cultural Caregiving, and Caregiving Needs. And the speakers today are Jaspreet, Chowdhary, Paurvi, Bhatt, and then myself, Maithreyi, Shankar. And the order of events today, we wanted to first start with Rosalynn Carter's quote. There are only 4 kinds of people in this world: those who have been caregivers, those who are caregivers, those who will be caregivers, and those who need them. So with that, we wanted to have a kind of a round of raising hands. Who all of you are currently caregivers? A lot of the room. Who have been caregivers, and then who thinks they will be a caregiver, and who thinks they'll need care. So with that, we want to get started with our agenda. We wanted to kind of walk through basically what the run of show will be today. We're going to be sharing personal stories, themes we see in our community, and how this connects to the South Asian experience, and how this context of caregiving operates all across the caregiving journey. And we also wanted to provide resources for care patients and caregivers, as well as gather questions from y'all and address them at the end of the session. So I'll start with my story, then I'll share pass the baton to Paurvi, and she'll pass to Jaspreet. But before that, we wanted to make sure you have paper with you, paper and pen. If you have any questions for us as we're going through the session, or if you have any comments or you want to share any of your stories, feel free to note them down. Our volunteer Maya will gather them near the end of the session so that we'll be able to address them, and especially if you don't want to share your name or wanted to keep it more confidential, you have that opportunity there as well. So with that, we'll get started. And I'm on my tippy toes. If there's a way to not have that be. Okay. Let's see. Awesome. Okay, thank you. I wanted to share my personal story first. So my caregiving context is I'm a sibling to a brother who needs care. So he was diagnosed with a neuro illness when I was about 12 or 13. And that has been a context I've grown up with and had rumbling in the back of my mind since then. And right now my parents are growing older, they're having health issues. I want to find a partner and start a family relatively soon. So what I'm facing as my future caregiving journey is the sandwich generation, where I'll be caring for my parents and caring for my brother and potentially also caring for kids. So with that, I think thinking about caregiving has been part of my journey in a very embedded way that's unique and not always what other people face. And for me, it's also driven a lot of my decisions. So if I'm looking at cultural caregiving contexts, we have such a stigma about talking on this topic in our community, though as you saw with the hand raising, we all face it. So that's something that's kind of also been part of how much I've shared with my own personal network around this topic. I haven't really shared with a lot of people, just my close friends, family friends, that kind of thing. So this is kind of the first time I've spoken about this publicly. And then another thing I've thought about, and also all of our network, this phenomenon of being the eldest sister or eldest in a immigrant family, and what that responsibility looks like. So when you're the eldest, you're kind of caregiving for your siblings if you have them. You're also kind of taking care of your parents or thinking about them. What does care look like for them in a very unique context, and that expectation is there that you're going to give care. And that effect is also there on your career and life choices. So for me, this manifested in trying to be a research scientist for much too long. I spent almost 15 years trying to go down that path. And then I learned and unlearned choosing a path based on my brother's needs, right? I wanted to fix everything, and instead of trying to do that, I leaned into my skills, and now I'm a management consultant. And the other effect it's also had is on personal life decisions. So when I'm looking for a partner, this comes up a lot and has actually prevented me from finding someone in the more easier way, because they don't always understand this context. I've heard from families, and my parents have heard this as well. They're like, your family is so amazing, we could never do what you're doing. This is the context we just live with and have figured out what works for us. It's not something that we should be like expecting praise for. It's just our lived reality. And I think the more we share our stories around it, the more it becomes ordinary in a very special way. Like we all share this experience. Something I've heard from one of my friends, he's cared for his mother who has MS, and he has 2 other siblings. One was in medical school and doing residency, and the other had another career, and his was the one that was like left to be sacrificed for a few years so that he could help his family. And they had decided that after her diagnosis and after all of these things, they had like a family decision conversation to decide it, which I think at least they did that, but it's almost like, do you want to get ahead of those decisions, find a way to like have those conversations early? And the sense of familial duty, I feel like we all have this, we all have a sense of where we're going in terms of caregiving and like where we'll need to spend time to take care of our parents, but there's also guilt if you aren't the one to do it, or if there's someone else in your family who has the burden of care, or if you do choose to go down a path of having a care facility or anything like that, there's a sense of guilt that comes with that is something we should also try to overcome. So these are some of those cultural caregiving factors. And then I wanted to also talk about a couple of aspects to consider when we're talking about caregiving. Culturally relevant resources, something that we've talked about across, and I know Paurvi and Jaspreet have like specific resources to share, but the importance of that is really, really key. So having care and caregiving in our communities, there's a nonprofit that I know of in Massachusetts, and I think Oregon as well, that works specifically with South Asian mental health youth who need additional care and support, and they work with temples and they work with volunteer hours and kind of provide a way for them to interact with the community. There's also a lot of senior centers we've seen across the country being very culturally competent or embedded in temples or other religious centers, and can provide that bridge that gap for our elders as well. And something that has come up with our family has been the kind of the gaps. So like the transitions from high school for my brother to college and then into kind of living at home. It's been nice to have a stable routine, but it's after 10 years of that, my brother's like, I want to go out, I want to have friends, I want to do things. He's 33, like he wants to be out in the community. And because of the stigma and because of time and because my parents are also have their own lives, finding ways to balance all of that has not been particularly easy for us. So we're still in kind of a transition mode, just discovering what will work for all of us. And also with that comes caregiver care. My dad takes a lot of the burden on, so does my mom, in taking care of him, but figuring out ways for them to have some respite. Like if I can come in to town for a few weeks to provide some care for them so that they can relax. I've been trying to do that. And then the informal and formal Desi network. So we all are kind of an informal Desi network right now. How do we leverage that to really be cognizant of what we're doing, and also share resources and knowledge and transfer that knowledge. So I had a conversation earlier with what's your name again? Sanjay. So Sanjay and I were talking about how like these networks are formed, and like you have formal ones and you have informal ones, and you have your friend circle that you talk to about caregiving because they'll ask or they know your parents or they know who needs care in your life. But you're kind of leveraging resources, getting resources from people who've been through it before, but you don't have a place to go to just say, okay, they see like memory care, what does that look like? Or if I don't want to go to a facility and my parents don't want to go somewhere, how do I make sure that they get the care they need at home and leverage the resources? And I know both of you are going to talk about that later as well. But these are things to consider as we're getting into this topic. And especially to call in when you're thinking about caregiving, you all are doing it, you're already in that work. You don't have to get an A+ in caregiving. I think that's where I want to end. It's like the one place where sometimes if you're just meeting needs, you checked the box, you did it. There isn't like a idealist way to do it, and I think I feel like I had a complex about this for a while, so I had to like unlearn that. So with that, I'll pass to Paurvi.
Thank you, Maithreyi. This is the first time she did this, so I just have to say that takes a lot of courage, and it's not easy to talk about these things. It's the only way to talk about these things is to bring the personal experience and the technical side that we all have our LinkedIn profiles, we all have a career. Those two together are what we need to do when we talk about this work. And that takes a lot. It takes a lot to break that down. So I just want to thank you for that. You are the next generation of all this. You're going to do the same thing, Jaspreet, I know. And so for me, I'm Paurvi Bhatt. I'm with the Rosalynn Carter Institute for Caregivers. And you saw the quote from Mrs. Carter earlier today. It is the most inclusive way to think about what we're all going through, because we're all going through it. It is the best hope we have to be able to move forward, is by thinking that way. So I hope that we can bring whatever our experiences are into this discussion. I'm not only just Paurvi Bhatt, I'm a former caregiver and a current griever. I'm an only child. I'm a second generation Indian American immigrant. My father came in 1963, steerage in a boat on a cruise liner, pre-civil rights, pre-second round of Immigration Act. My mom came 2 years later when he could afford to bring her, and I came a year after that. So that is our story. Why do I introduce myself this way? It's because they don't have a digital footprint, I do. Which means when my cousins, children's children somehow end up on whatever Ancestry.com is going to be back in those days, they'll find me. And they'll assume I was the first one, when that isn't the case at all. We're a new immigrant category in that regard, and so it's incredibly important. And believe me, I rolled my eyes every time my dad told that story. And I can feel him thinking, see, you got to tell the story, and I do. So we are here on behalf of that. It's important to say we are holding the Carter family in our hearts. They are going through so much in a year's time, and we know that this last lap of what President Carter is going through is partly why we're here as well, because it is a moment that we all go through, which is to hold the hand of someone in their last round. So with that, let's keep going. So who are caregivers? Now, I'm going to be presenting data, and hopefully you'll see yourself in it, and we'll see our community in it. So who are they? Women are disproportionately. That's not a surprise. We hear a lot about working mothers. As an only child who didn't get married, so my 3-year story is very, very real to me. My father had early onset dementia at 58. I'm 58 now, so that's very poignant to me right now. I was 28, and again, an only child daughter, which meant I had to make a lot of fast decisions about what was I going to do. And I also was not a doctor. All the doctor jokes are out there. I was in public health at a time when nobody knew it. Everyone thought I was going to be looking at restaurants and clearing them, and in fact, I was working in HIV, which was even harder. What's this daughter doing, going around brothels and figuring out what to do? All of that was going on when my dad came along with his dementia. He was not allowed in the front row of the temple. He was not allowed to go. He was very much excluded by the Indian community where we lived, so much so that I had to move my parents to Chicago, where they started their life together in America. I go through this because that is what's going on. We opened this plenary on mental health. That affects all of us in the way that we're reacting to each other, and we have to own our part of it. So the fact that it's disproportionately affecting women, we're making those choices earlier, and it affects us downstream. We also, and I can hear my colleagues who are men who are going through this, it's also not just because we're nurturers, both genders nurture. And so 48% are men. So it's all of us that are in it. But the women part is material as we get further into this presentation. Every generation is involved. Today we're worrying about the sandwich generation. My mother had cervical cancer when I was 3, which meant my father was a caregiver at that time of me and her, which meant he was also sandwich generation, worrying about parents that were in India and not even experiencing what it looks like to age, let alone take care of people. So that, where you see the bar charts where they're super high, we're all in them. We're all transitioning through them, right? I'm in the middle one. And the worst part was in the middle, right? But we're also, back to the original quote, we're also worrying about what's going to happen to us. So it's important to bear in mind that these things aren't stagnant. We're coming through it in a life cycle way. And then finally, the fact that the U.S. labor force is deeply impacted. We have to be able to take time off. We have to be able to come take care of whoever's in our life and be able to get back in. And again, the pipeline for working moms has been set and hard fought, and working dads, so that if you have to pull away, you can, and you can come back. And it's a happy time when that happens. But the leak is happening for working daughters more so than anyone else. It happens later. It's finally, especially if you're a woman of color, about the time when you finally got to where you thought you were going to be, and then all of a sudden it's time to drop out. And you will willingly drop out because of what you need to do. Certainly happened to me, and there is no pathway back. So these figures are incredibly important for us. I'm going through my story. That's my mom, and that's me many years ago. I won't go in greater detail. I'll continue to tell our story as we go. I lived with her for 13 years after my father passed away. The experience I go through today is much more like a widow than most people would realize. So it's important to also recognize when these trade-offs are going on, they're affecting everything. And bereavement is a huge part of this. Anticipatory grief is very real. I can honestly say my anticipatory grief probably began when I was 3, when she was in a hospital. And all of a sudden you have to manage things forward. The reason why I go into this is because we started this session with mental health. And that is going to have to lace through everything we do in these next 2 days if we're going to change any of the things that we're experiencing. So if we look at this, this ring is fascinating to me. So we're the smallest sliver there. Part of the reason why is because we don't talk about it. We don't come right out and say, yes, we do take care. Why? Because as you can see, most of us say it's just what we're expected to do because it's our parents, 9 out of 10, or a loved one. But if we don't disclose, then we don't afford ourselves the opportunity of all of the supports that are there for us. So it's really important to disclose. What else do we see here? We also see that white caregivers are more likely to have better health. That's also not surprising because the system's set up to make sure that people can access that health, right? But also, they're disclosing. It's a more safe space to be able to disclose at work and beyond when you're inside of the majority system. And then we see that, of course, the intensity of care is pretty extreme as you move through the populations of color. And again, some of that's cultural and how we deliver care to each other, what we come into, and it's also because we don't have access to a lot, so it requires a lot for us to lean on different things. So now, back to Mrs. Carter. She had the wisdom out of lived experience to think about caregiving and mental health 40 years ago. We only are now unearthing how impactful she was as a first lady, let alone as a change agent. She did it, as the Carters have often done, choosing the things that are unseen and slowly making them seen through the work, not worrying about what your name tag says, not worrying about the microphone, just doing it. But at that time, nearly 40 years ago, she was speaking out on mental health. Who would have guessed that this era, where we're in right now, has both of these issues that she chose to work on so long ago are the ones that we're in crisis on today. It's incredible to be in a time like this, and that's why it's important for us to stay just as visible in these issues for our community. The one thing that we're noticing, and again, if you're taking care of anyone, you know, that worrying about the specific disease state is what the health system worries about and where reimbursement comes from. If you're taking care of someone, You know that maybe there are 6 pills that need to go in the pill box because there's 7 conditions that those 6 pills are needed for, but you're worrying about getting it in the pill box. So what disease it is matters, but what the stress is coming from is all the work you've got to do to get ready. So what we're starting to work on as the RCI is pull up about any specific disease state and really look at what do caregivers go through and where are the stress points and where are the opportunities. And because there's cultural elements to all of it, we know that at those stress points, some of those stressors are coming from us. They're coming from our community. So we've got to better enable how to get relief from our community, get more education from our community, and also better understand those stress points and be open about it. And 9 out of 10, things like food are where we tend to break down, right? Back to work. We've had, there's a lot of detail here. I'll go through a couple. Most of us have to leave unexpectedly. That's not surprising. Many of us have had to quit, and we disrupt our workplaces is how it's viewed. But at the end of the day, when we start talking about this more openly, which is why we need to disclose, we have a better opportunity of changing the world of work in a way that's supportive to all of us. Much as we do when people go on maternity leave and paternity leave, how do we normalize all of this is the next chapter. And something as specific as even bereavement leave. None of us wraps up bereavement in a day if you're lucky to get a day off. I'm Hindu. I need my 15 days. And that is all wrapped up in us being much more open and saying this is what we need versus adjusting to what we got. And I come from a generation of second gen who basically were taught to just adjust to what you got. But we can't continue in that anymore. This is one of the most important things that I know that our organization has done, and I'll wrap up on this soon, and it's really shining a light on emergencies, natural disasters, times that are unexpected. I'm learning as I go that President Carter actually created FEMA. So this is right in the lane of what the organization does. And so I come from the Midwest. Tornado drills are big, right? Now wildfires are picking up. Whenever we have a tornado drill, no one has ever said, do you know what you're going to do if your mom's on oxygen? Have you sorted out how you're going to make sure that there's a backup battery if you're doing something that requires a plug-in? None of that happens. I was a caregiver that was living with her and traveling for work. I was stuck in a wildfire in California. Did I ever once consider that she might be worried if she saw that on the news and who was going to take care of her if I couldn't get home? That is a universal experience that hits everybody, and yet none of the things that we do for emergency response or even first responders comes to us. I have a sticker on my house that lets everyone know I have a dog in the house if something were to happen. We get Amber Alerts appropriately if there's something with a child, but we have nothing there if there's anyone that's disabled or elderly. So this is something that we are taking on very intentionally and hoping we can work with temples and others to take this on with us. So this is my family, and I'll end on that. My parents, thank you. My parents, that picture off to the left, that was taken 2 weeks before she found out she had cervical cancer. That was the last time this entire family was fully healthy. That's when, I'm not going to go into where we were in Niagara Falls. We all have the classic photo from there. And then my dad proudly, before his dementia started to show initial signs, proudly with me when I finished at Yale for public health, when he finally understood what public health was and was okay that I didn't become an engineer or a doctor. So that's our family. We're proud. I know they're proud that I'm here to tell their story. Please advocate. This is the time. We are coming forward to say we need an Office of Caregiver Health, because if we don't have that, we're not going to get to an efficient way to get things done. If we don't even speak the language, which we don't speak the technical language, half of us are not able to speak English in a way that will help us get these things done, and so they're relying on us as second gen and first gen. We have to advocate now. Connect, of course, and check in. You have a piece of paper. While we finish this conversation, there's someone in your life that is caring for someone. Take a moment to check on them today. You'd be surprised how many people are just overwhelmed that someone remembered them and that they were going through this. So that's the biggest thing. Mrs. Carter would write quiet notes to anyone she could think of that was going through this, and so that's part of our legacy and our commitment to her. Crisis text line. For if you're a caregiver in trouble, of course there's 988 because there's an overlap with mental health. Please give, of course. We don't have enough organizations in this space. And tag us. We don't have our hashtag up, but it's Desi Care, Desi Loss, and continue with us. Now, I've gone a little bit over time, but that's where the Desi comes from. So I'm going to give back some time to Jaspreet. Thank you.
All right. Thanks, everyone. So excited to be here. I'm with Compassion and Choices. And before I get into that, I just wanted to share in the spirit of everyone's personal story. I'm currently a caregiver to two amazing kids, a 12-year-old and a 9-year-old. I get to work at an organization that's committed to improving access to high-quality end-of-life care. Every day I think about stories of people like my incredible colleagues on this panel and all the things that they have shared and gone through, and I make it my job and my mission to create policies and do work that honor those stories. And my take on it is that wherever you are in the social justice space or wherever you are in an organization, you have a role in making it better. And that whatever skills and tools we have, if we bring our best into these moments, we create both systems and policies that both honor and make space for complex human experiences. So for my part, I'm going to give an overview of Compassion and Choices. I'm going to talk about how disparities continue through the end of life. I'm going to share some tools for charting our end of life experience, and then do some calls for action. So starting off, I have my little cheat sheet here. Compassion and Choices is the nation's largest and most active consumer-based nonprofit working to improve care, expand options, and empower everyone to chart their end-of-life journey. For us, this is how we mobilize equity and access into end-of-life planning and care. We try to have equitable approaches for engaging public health and acute care. We use evidence-based, data-driven numbers and materials to create our resources. We advocate for and support access to the full continuum of advanced care planning, palliative care, and hospice care. We work to dismantle systemic inequality and bias. And then, of course, we do community engagement in our policy creation. And what that means is that all of our policies are created with community voices and needs and perspectives in mind. With regard to advanced care planning, these are concrete tools that are legal documents that can be used to make sure those caring for you understand your wishes when you can't speak for yourself. There's generally 3 types of advanced care planning documents. They are a living will, a healthcare proxy, and a do not resuscitate order. All of these documents do different things, and you should find out which one works best for you. And I'm going to make a plug that Compassion and Choices, we actually have a booth in the expo room, and there's more information about all of these. There's also a medical document that you can complete with your doctor that's also sometimes called, it's either a medical order for life-sustaining treatment or a physician order for life-sustaining treatment. Ooh, big words. All right, then for end-of-life options. So regardless of how much you plan, hopefully you do plan, and if you don't plan, you're going to come up against end-of-life options. And this is hard and heavy and complicated for everyone. But it also gets much worse and much more intense if you haven't thought about it before. So when we think of what end-of-life options are, there's pursuing life-sustaining treatment if you have a disease such as cancer. There's refusing treatment if you get to a point where you are deciding that you don't want any more treatment. You can also discontinue treatment. You can stop current treatment plans that you're on, in which case then you likely will get to a point where you have a 6 month or less prognosis, and then you can enter hospice and receive comfort care. While you're in hospice, you can make decisions about how you want the rest of your life to be, which includes VSED, which is voluntary stopping eating and drinking. And then in currently 11 jurisdictions, there's also the option of medical aid and dying. Again, I cannot emphasize this enough. The most important thing is to think of what works for your values and beliefs. And that absolutely includes, as uncomfortable and hard as it is, to think about what you want the last chapter of your life to look like. And sometimes it's very hard and daunting to enter into that conversation and to start that discussion and think about. So I think that one of the ways to enter in that space that may not be as intimidating is to think about deaths you've witnessed or end-of-life experiences that you've heard about, and pull from that what resonated or felt good, or the opposite, what didn't feel good and what you didn't want, as a starting point for thinking of what would work best for you. And then ways to get involved. Start conversations with loved ones and healthcare providers. We actually have at our table, I need to put this microphone down so I can show you guys. Okay, I can't. Well, I'll get to that in a second. Start conversations with loved ones and healthcare providers about what your needs are, what you would like. Part of what we're doing here with this session and with Impact generally is making the implicit explicit, bringing things, destigmatizing conversations and topics that are really hard and challenging. And that begins not just in legislatures, not just in temples, but in our homes, in our communities. Think carefully about your needs, wishes, and priorities for various scenarios, including the end of life. Connect with an attorney or an organization who can help you complete advanced care planning resources. I feel like at Impact and an Indian American organization, there's likely a lot of attorneys here, but there's also organizations that would help. Compassionate Choices, we do have some information and resources to help complete advanced care planning documents. Once you have completed advanced care planning, you got to tell people about it. So make sure your loved ones and healthcare teams know, A, that you have those documents completed, and B, that what your wishes are. And then it's also important, as our lives change, so might our wishes and so might our plans. So you need to revisit your plan annually, but at least after major life events. Think of like if you get married, if you have kids, if you get divorced, after a death of a loved one. All of those things are good opportunities. Finally, educate yourself about end-of-life options available in your area. There are organizations that do work in this space nationally, including Compassionate Choices, including the Rosalynn Carter Institute, and find out what is available in your area, and then also what is being advocated for. On that note, advocate for expanded end-of-life care options. So our state legislatures are very static and changing, and so there's always, I feel like, legislation related, not just to end-of-life care, but to healthcare generally. And if you see something or want something, it's important that lawmakers hear from you, because every lawmaker will say that they are committed to what their constituents want. But if you're not communicating with your lawmaker, then you're not part of that conversation. And so they don't get to hear what's important to you. And then finally, if you are a lawmaker, several members of Impact have actually sponsored legislation that Compassionate Choices has worked on, and we're super grateful for that. But consider sponsoring legislation to expand and improve end-of-life care. I wanted to give just highlight that we at Compassionate Choices are engaging with diverse communities to improve end-of-life care for all. And if you'd like to learn about any of these leadership councils, please come and visit us. We're always looking to engage with more folks and to get more members. And then finally, we have resources that I am going to try to highlight by holding up. So we have an end-of-life decisions guide and toolkit. And we have copies of these available at our table. There's also, because it can be complicated and hard to initiate conversations about end-of-life wishes, we have a one-pager to give some pointers. And then We have a dementia values and priorities toolkit for folks to take and look at. And I believe these slides are going to be distributed after, and so all these links will be live, and you can find all this information on our website. Thank you all so much. This is our social, and we'd love to hear from you and stay in touch. Thanks.
So we have 10 minutes left, and if we have any questions, we can either pass the mic to you, or if you'd like to pass your question to Maya. If you have any questions, she'll collect them now, and we'll be able to address them. Go ahead. Do you want the mic?
Oh, you want me?
If you don't mind.
Yeah, sure. I'm Shilpa. I'm a filmmaker, and I'm the oldest immigrant daughter in the whole family. So I've been taking care of my parents. They're both like 75 and 76. And especially with the pandemic, it went into overdrive. And then I was wondering which aspect of the whole caregiving industry you think is facing the most challenges. But generally, I mean, it's a long story, but I started looking for resources. I went to the town, and they were like, here's a list. These people charge $150 an hour, you know? And it's like such an exclusive thing. And then recently, my dad had a stroke after coming back from India because a long flight caused dehydration. So then we were looking for aides, and now there are some services in Queens where they hire Nepalis or Hindi speakers, which provides a little more comfort. I mean, obviously they're English language speaking, my parents, but like there are some services now, but it's like such a huge, field. And then now there are also some nursing homes and things like that, but they don't really cater necessarily to South Asian food. Like they went to all these open houses and they were complaining about the food and stuff like that. So there's definitely so much more growth. So it's great what all of you are doing. And I hadn't even thought about siblings and other stuff like that. So yeah, thanks for this presentation. But generally, is there any one aspect that as people who are experts in all this you think needs the most attention or something?
You just nailed it, right? You're experiencing it directly, and I think we've got a whole room of people. We have a whole room of people that can probably help answer that. But I think it's a personal view that when care comes home, home isn't ready, right? So to everything that you're saying, whether it's people that are going to be able to take care of our community, or even understand that if you have a Medicare Advantage plan and they say that they're going to give you food when the person is discharged from the hospital, that food isn't going to be what we need, right? So that didn't relieve the elder daughter thing because you still have to go in the kitchen and do the thing, right? So I think it's the whole pathway of what happens when we unlatch from the health system, and the health system's assuming we're going to be doing all the things at home, and that the reimbursement of it, the financing of it, and the fair wage of it isn't keeping up with the needs. So that's from where I sit. And then the cultural things we need, everything from bereavement care to how do you, I've often said, you say a word like chaplain, you just separated the majority of people that could use that kind of compassionate care. Because the word it's not what's being delivered as much as it is the word, right? So there's so much of that distances. So I think it's that part for me. And before I give up the mic, can we just, I'm just going to do this. Jaspreet's mom's in the room. So we are so lucky to have someone from the generation that we're here to support as well. So Auntie, welcome.
There you go.
You can't even say that I have egg in the house that you won't eat it. Or if you have, something wrong, I'm sure they didn't have something, that kind of stuff. So I started looking, and you won't get much help from the organization, but you will word of mouth. Start talking to your neighbors, talk to people, and I was surprised I got at least 10 people who were willing to come and cook in our house for her. And you could do the groceries yourself, and then they will cook for you, or they could do the groceries too, but you may not trust them, whatever. So, but what you could do is do that, and then there's some people who say, we can come and cook for you, and a lot of families say, come and cook, I cook enough for a week. And we keep it in the fridge and we eat it for a week. Others will say, no, I eat only fresh food. Okay, fine. But either one. And they were reasonably priced. They were not so expensive as you all think. 150 an hour is outrageous. And you know, some people can afford to pay and some people cannot. So that's the thought. And the other thing you might find is from the local temples. You know, I'm a Sikh, so I go to Gurdwara, and it's amazing how many people you will find there. Oh, my mother has come from India, and she's so bored she wants to do something. Can she come? And she's in good health and she would like to do that. And you know, when it's a peer coming to your house, it's much easier, and you don't have to justify some things like you feel embarrassed to tell somebody much younger than you. If it's a peer, you feel, okay, they'll understand. So that's the thought, you should go through that route, because going through the agencies I have found it very, very expensive. And then you don't find the person who could do it. And then just one more thing about, who we're talking about, end of life things, your directives. And a lot of people will not recognize the terms they use, but if you go to your doctor's office, they'll ask you for advanced directives. So that's another thing. You might say, I have advanced directives, but I don't have end of life care. You do have it. Just
I'm Nelson Garcia, colleague of Jaspreet and Compassionate Choices, and I handle I'm Director of Federal Affairs for the organization. One of the things that I discovered, having worked for the organization for a little bit over a year now, we talk about caregiving and our concerns about our loved ones in the United States. What happens if our loved ones happens to be in another country? And we are in a situation where, in my case, having been born in the Philippines, my mom is in California. It's dreadful enough to think of that distance when, if something happens to her, fortunately I have a sister that lives in the same city, so you know, I have some kind of warning if something happens. But my mother, on the other hand, had to be concerned about a sister, a mom and dad, 11,000 miles away in the Philippines. And what's also challenging is the fact that as a predominantly Catholic country, the idea of a medical aid in dying option is non-negotiable. No doctor, no hospital, no institution in the Philippines will even consider medical aid in dying. So those are just some of the challenges I think that we may have to address in the future, not just in this summit, but in other summits along the way. Is what happens, and many of our relatives who immigrate to the United States find that they want to go home. Because it's cheaper there, the family is there. Those are some of the issues I think also need to be addressed.
Can I add something to that?
Just to add a little bit to that, and just looking at it in a 360 view, having witnessed what my parents went through in a very similar time, so I'm a bit older as a second generation person. There's also the pain and the mental strain and the separation anxiety that a child has when a parent or anyone else that's overseas is so far away from them. So it's also what people want for themselves as they go, but they also leave someone behind who's going to be going through bereavement the minute they get down that plane to go somewhere else, or I'm sure is, you know, the pain of thinking what might be happening in the Philippines while you're here. So I raise that because as we think about how to support each other, that part of it becomes important because it's about the caregiver centered first, while we're also taking care of the recipients, right? And so I say that to you in particular because you're in this community and what Shilpa mentioned in terms of what can we do.
So in thinking about bereavement, this brings it up with for me as well. With bereavement, sometimes when you're in a caregiving for a sibling, like you have to prepare them also for what's coming, and that's something that's been on the mind a lot. Is like part of my whole thinking about the future is like, oh, what will happen when my folks are gone? But I'm also like, what will happen to, like, what will he think, and how to prepare him for bereavement also, because I don't know what that's gonna look like. But we also only have 1 minute left. If we have any last question, we can grab it. We'll back there. Okay, yeah, sure. Unless you would like to.
So now we're at the stage where he potentially needs to be sent to a home because, like Shilpa said, home care is extremely tricky. My question for the panel is, what is lacking in the US with regards to having senior homes specially catered to Indian parents, like with their community and stuff? Is it a public-private partnership that's missing? Is it just everything private? If you just
One community care, I think I want to say Florida, that's South Asian centric. So there's modeling. I think it's more of like what both of you shared about advocacy. If we advocate more for it and we also come together and figure out how to create solutions, those public-private partnerships or public options, or how do we make more facilitative things that work in our community, we have to kind of come together more to create those options because everyone else has created them for themselves. So.
One thing I'll add, and where my advocacies come in, is I stay with food because that's the easiest one to start with, right? But if I can get a Hindu meal or a Jain meal on United and Delta, and I can't somehow be able to make sure that a mainstream assisted living can make sure, because my father was also in memory care, it was not easy, right? That we could get what we needed there. That's an issue of intent. It's not that it can't happen. There's absolutely no reason why Bhatt doesn't produce stuff and then ship it, right? But we just have to ask, and ask our insurance providers to ask, because they'll get more share. We'll all join. Every Desi's going to tell every uncle and auntie that that's the plan to be on once we find out our stuff's going to be there, right? So I think the challenge in this is to not compartmentalize and create a parallel thing, but figure out how to integrate. Because if the airline has it, I don't have a separate airplane just because I want Indian food. I also don't need a separate, I am not going to want to be in an assisted living that's Desi only. I didn't grow up in a world that was Desi only, right? So I think that's where we need to try, because the fast solution is to go to one of those centers for our parents, but then think ahead. I don't think we're going to necessarily all want to be there too. So we have the moment right now to change that. Nothing to add. All right, well, I think it's time to take a break. Thanks for being so open and being in this conversation with us.
I think they're running a little late, so I wanted to say.
Yeah,
do you want to say something?
Yeah. Firstly, thank you so much for the presentation. It's a subject that we all deal with and will be a part of our lives at some point, but we don't talk about it at all. So it's important in this space like this. Thank you so much. In terms of schedule, we're starting the next session very soon, ideally in the next 2 or 3 minutes. We'll continue sustainable organizing in this section with a discussion on mental health. There is a session in the ballroom on tech and AI, and 2 sessions upstairs. One scheduling change, the Laughing Out Loud session is changing with the Asian American hate crime session, so that'll be upstairs. And then at 4 o'clock, we have some special guests coming to speak in the main ballroom, so you definitely want to stick around and be there for that. That'll be an exciting session. So thank you so much for coming, and go ahead and head out to your next session.
Thank you.